All right, welcome back. Today we're jumping into the incredible world of antiparasitic drugs. And let me tell you, this isn't just about popping pills. It's a story of targeted, microscopic warfare, a tale of chemical weapons designed to hunt down and take out invaders that are literally hiding inside our own bodies. So let's just start with the core problem, right? How in the world do you fight an enemy that lives inside you? This is the huge challenge that these drugs were made to solve. You can't just go in with brute force. That would hurt us, the host. It has to be all about strategy, about precision, and about finding the enemy's biggest weakness and exploiting it without causing a bunch of collateral damage. Okay, so let's get a really clear definition down. Antiparasitic drugs are just medications that are specifically engineered to fight infections from, well, parasites. These are organisms that basically set up camp on us or, inside of us, and they live at our expense. And the problems they cause can range from just being a little annoying to being seriously life-threatening. To really get a handle on the weapons, you first have to understand the enemy. I mean, in any battle, intelligence is everything. So before we get to the drugs themselves, let's get to know these unseen invaders. When you boil it down, our parasitic foes fall into two big categories. On one side, you've got the protozoa. These are tiny, single-celled organisms, totally microscopic, and they just multiply like crazy inside the host. Then, on the other side, you have the helminths. Now, these are multicellular worms. We're talking about things you can sometimes actually see, and they have much more complex life cycles. So right off the bat, we're dealing with two very different enemies that are going to need two very different strategies to defeat. So how do we actually attack them? Well, the secret, it's hidden right in their own biology. This is kind of like the know your enemy part of the briefing. A parasite's own anatomy, its very structure, actually contains the seeds of its own destruction. We just have to figure out the right key for the right lock. For those single-celled protozoa, the targets are super fundamental. Their plasma membrane, the skin of the cell they use to eat, that's one vulnerability. But the real bullseye, that's the nucleus. If you can mess with their DNA replication, you stop the entire invasion cold. Game over. Now for the bigger, more complicated helminths, the worms, we've got totally different targets. Their outer layer, this thing called a tegument, it's like a suit of armor. But it's an armor we can pierce. Even better, their muscular and nervous systems are fantastic targets. Think about it. If you can paralyze the worm, you completely neutralize it. The body can then just get rid of it. All right, so we've got our intelligence. It's time to bring out the big guns. Let's start with our arsenal for fighting those tiny, single-celled invaders, the protozoa. And our first weapon is a real powerhouse, metronidazole. The best way to think of this one is as a DNA shredder. It's incredibly specific. It doesn't just slow the parasite down, it gets inside and literally dismantles its core programming from the inside out. So how does this DNA shredder actually work? This is the really cool part. Metronidazole just slips right into the parasite cell, but once it's inside, the parasite's own internal machinery accidentally activates it, turning it into this super reactive molecule. This newly activated molecule then goes on the attack, binding to the parasite's DNA and just breaking the strands apart. The parasite can't copy its DNA anymore, and without that ability, it just dies. It's a beautiful, efficient, internal takedown. So, what does this DNA shredder actually target? Well, for anyone in the medical field, there's a brilliant little mnemonic for this, GET, GAP. This handy phrase covers a whole range of common infections, from protozoa like Giardia and Entamoeba, all the way to Trichomonas and even some bacteria. It's a simple way to remember its surprisingly wide range of uses. Of course, no weapon is perfect. There are always potential side effects. And for metronidazole, we've got another great mnemonic, DR heads. This helps remember common things like headaches and dizziness, but it also points to a really, really important one, a disulfiram-like reaction. This means you absolutely cannot drink alcohol while taking it. It can also cause this weird metallic taste, which is a classic telltale sign. It's a really powerful tool for remembering the drug's full profile. Okay, let's switch gears. We're moving on from the microscopic world of protozoa to the bigger, more complex helminths, the worms. And this, as you can imagine, requires a totally different set of weapons, known as anthelminthics. So first up in our anthelminthic arsenal is albendazole. And if metronidazole is our DNA shredder, you can think of albendazole as something that dissolves the parasite's skeleton from the inside out. It's an attack on the very structure that holds the worm's cells together. Here's how it works. Albendazole gets inside the parasite's cells, and it stops something called microtubules from forming.
You can think of these as the tiny scaffolding beams, or like the rebar in concrete that cells use for their structure, for absorbing nutrients, and for dividing. So by taking out this internal scaffolding, albendazole basically starves and immobilizes the parasite, which leads to its paralysis and eventually its death.
Now, you're probably starting to notice a theme here, right? This idea of paralysis is a really common and really effective tactic in this war. Several of these drugs are specifically designed just to immobilize the enemy, making it totally powerless against our own body's natural defenses. A perfect example of this is Ivermectin. This drug is a master of precision, like a surgical strike. It targets a very specific type of channel that's only found in the parasite's nerve and muscle cells. It's like a key that unlocks a floodgate for chloride ions. This flood rushes into the cells and essentially shorts out their entire nervous system, causing paralysis and death. And here's the genius part. We humans don't have these specific channels. That's why the drug is so deadly for the parasite, but so safe for us. It is a perfect example of selective toxicity. Our final major weapon against worms is Praziquantel, and this one is just fascinating. I call it the armor piercer because its whole strategy is about breaching the parasite's defenses and exposing it to attack from our immune system. Praziquantel has this devastating two-pronged attack. It's a real 1-2 punch. First, it causes this massive, uncontrolled flood of calcium into the worm's cells. This triggers these intense spastic muscle contractions that lead to paralysis. But it doesn't stop there. At the same time, it severely damages the parasite's protective outer layer, that tegument we talked about. It's basically punching holes in its armor, which finally allows our own immune system to see the invader and attack it directly. So we've seen the enemies and we've seen the weapons. Now, let's bring it all together. This whole field isn't about carpet bombing the body with poisons. It's about precision chemical warfare. It's about matching the exact right weapon to the exact right weakness. And this slide right here, this is the master battle plan. It lays it all out. For the single-celled protozoa, we go after their DNA replication with a weapon like Metronidazole. For the roundworms, or nematodes, we can either hit their internal structure with albendazole or short-circuit their nervous system with ivermectin. And for other kinds of worms, like flukes and tapeworms, we pierce their armor with Praziquantel. See, every single weapon is chosen for its specific effect on a specific vulnerability. So if you take one thing away from this, it's this. Antiparasitic drugs are not just crude, random poisons. They are incredibly elegant, highly specialized tools. Each one is designed to be like a molecular key that fits a very specific lock, a lock found only in the parasite's unique biology. And that is what lets us destroy the invader while leaving the host, us, relatively unharmed. And that brings us to our final thought. This microscopic battle, it's still going on. It's an arms race. Just as we develop these brilliant new weapons, the parasites are constantly evolving resistance. And that leaves us with a critical question for the future. As our microscopic enemies adapt and change, how will our chemical arsenal have to evolve to keep up? The war is far from over.